I actually am from Robeson County. I grew up in a small town just about 10 minutes north of Lumberton called St. Paul's. St. Paul's is actually where I met my wife, because she's also from northern Robeson County, a little community called Parkton, and graduated from St. Paul's High School, and ended up going to the University of North Carolina at Chapel Hill, where I studied biology, and graduated. I did pre-med training at Chapel Hill and graduated with a degree in biology, and got very lucky and got asked to go to Wake Forest University Medical School after that. And I stayed there for 4 years, and then I stayed on after my medical training at Wake Forest and went to, I stayed there and did my internal medicine training at Wake Forest. My wife and I were married during the time I was in medical school, so our first home was in Winston-Salem together. And from there, we got the opportunity to move to a beautiful city in Lexington, Kentucky, where I went to the University of Kentucky and did my cardiovascular fellowship training at the University of Kentucky Medical Center. And after that was completed, I had the great fortune to join on to the Interventional Cardiology training program at Duke University, where I've been for the last 12 months. And now my wife and I have been very fortunate to be able to get back here to Robeson County, and now we're living in Lumberton. The people are wonderful in Robeson County. It really feels like home to me. We can understand the values of the people in the community and what's important to the people. We share some of the same background as other people who are from this area do, and we saw it. For one, both of our families are still in Robeson County, and so we thought that one of our priorities was to eventually be near our families, but we also saw a great opportunity here to join the community here around the hospital, and to participate in the growth that's going on at Southeastern Regional, and it's been very, very exciting. I've always been interested in basic physiology, and I think the heart is a pretty simple model for overall physiology. And I had an experience where my grandfather was ill and had a myocardial infarction or heart attack when I was about 14 or 15 years old, and ended up meeting some of the cardiologists at Duke University Medical Center in Durham. And from there, I kept an interest throughout college and medical school, and decided after my internal medicine training that I would see if I could pursue that as a career, and it's worked out so far, so I've been very happy. Heart disease in general and cardiovascular disease is so common and so prevalent, and it has such a burden on people that it's nice to be able to treat all aspects of cardiovascular disease, and then to be able to see patients respond and get better with the treatments. And also, cardiology as a field is it's changing all the time, so it provides lots of opportunities for new and different directions of study and new therapies for patients, and so I find it to be very exciting. I am trained in interventional cardiology, so my special procedures that I enjoy performing and that have opportunity to do most would be coronary angiography, coronary peripheral interventions, balloon angioplasty and stenting, local treatment for atherosclerosis from a percutaneous approach through a catheter. I also do participate in all the general cardiology practices, so we do ultrasound, cardiac ultrasound, stress testing. We treat all of the general risk factors for cardiovascular disease, so hypertension and hyperlipidemias or dyslipidemias and other things like that. But my main focus is on interventional treatment of coronary atherosclerosis, which we do here in the cardiac cath lab. I am constantly amazed by some of the things that we're able to help patients with every day. even though I've spent a number of years now training in cardiology and cardiovascular medicine, it's still pretty humbling to see some of the things that we're able to accomplish in treating and stopping disease progression and focusing on more prevention. But the real reward comes from each individual patient that you're able to see when they're able to do things or enjoy activities or spend more time with their longer time, better quality time with their families. When I get those kind of reports back, that's the most rewarding thing. Patients are starting to have a better understanding of the risk factors for cardiovascular disease. So just the level of awareness and understanding in the community is really increasing. We're still working on access into care, and that's part of our mission here. And part of why I think it's exciting to work in this area now is because there's lots of opportunities to increase patient access into care so that we can improve the overall health of the community right now. But education and awareness have improved dramatically. We still have to work on access. It's been a real pleasure for me to be able to work with one through the Duke University Health System and Duke Cardiology of Lumberton. I've appreciated the amazing commitment to the health care of the community, cardiovascular care and other services that Duke has made and that Southeastern Regional Medical Center has made, working as a collaborative effort to improve the overall health care of this community. And it's a genuine dedication to the health of the region that I find to be the most amazing thing. And it's a real privilege to be part of this institution and some of the fine people who've been here over the last number of years and decades to try to make it what it is today. And it's very exciting. The growth that's happening here is fantastic, and it's just a real honor.